Welcome to our channel. Today we're diving into the world of heart arrhythmias and the medications used to treat them. You know that feeling when your heart skips a beat? Sometimes it's harmless, but other times it can signal a real problem. We're going to break down the science behind these medications in a way that's easy to understand. Let's get started. So, imagine your heart's electrical system like a highway. Sodium channels are like the on-ramps letting electrical signals flow through and causing your heart to contract. Now, sometimes those electrical signals get a little too excited, leading to irregular heartbeats. That's where sodium channel blockers come in. These medications act like speed bumps on those on-ramps, slowing down the electrical signals and helping your heart find a normal rhythm. Think of medications like quinidine, lidocaine, and flecainide. They're like the traffic controllers of your heart. But just like with any medication, there can be side effects. It's important to remember that everyone is different, and what works for one person might not work for another. That's why it's crucial to talk to your doctor about which medication, if any, is right for you. They'll consider your individual needs and medical history to determine the best course of action. They'll also monitor you closely for any potential side effects and make adjustments as needed. Remember, it's all about finding the right balance between managing your arrhythmia and maintaining your overall health. Let's talk about adrenaline for a second. You know, that fight or flight response that kicks in when you're stressed? Well, adrenaline can also make your heart race, sometimes too much. That's where beta blockers come in. These medications work by blocking the effects of adrenaline on your heart. It's like turning down the volume on a loudspeaker. Your heart rate slows down, and the force of each beat decreases. This can be incredibly helpful for people with certain types of arrhythmias. One of the most well-known beta blockers is metoprolol. It's used for a variety of arrhythmias and can also help manage chronic heart failure by reducing the workload on your heart. Again, side effects are possible, so open communication with your doctor is key. They'll work with you to find the right dosage and monitor your progress closely. Remember, knowledge is power when it comes to your health. The more you understand about your medications, the better equipped you'll be to make informed decisions about your care. Chapter 3. Potassium Channel Blockers. Extending the pause for a steady beat. Think of potassium channels as the off-ramps on our heart's electrical highway. They help reset the electrical signal after each heartbeat, allowing your heart to prepare for the next one. Now, sometimes those off-ramps get a little backed up, leading to irregular heart rhythms. That's where potassium channel blockers come in. These medications keep those off-ramps clear, prolonging the time it takes for the electrical signal to reset. This helps prevent those rapid, chaotic heartbeats that can be so dangerous. Amiodarone is a commonly prescribed potassium channel blocker. It's a real workhorse, effective against a wide range of arrhythmias. However, it's important to note that amiodarone can have some significant side effects. Your doctor will carefully weigh the benefits and risks before prescribing this medication and will monitor you closely throughout your treatment. Remember, it's a partnership. Your doctor is there to guide you, but you're the captain of your own health journey. Chapter 4. Calcium Channel Blockers, slowing the flow for a smoother rhythm. Calcium is essential for muscle contraction, including the contractions of your heart. Calcium channel blockers, as their name suggests, regulate the flow of calcium into your heart cells. By doing so, they can slow down your heart rate and decrease the force of contractions. This can be particularly helpful for people with conditions like atrial fibrillation or atrial flutter, where the upper chambers of the heart beat too quickly and irregularly. Verapamil is a good example of a calcium channel blocker used in these situations. It helps to calm those erratic beats, allowing the heart to pump blood more efficiently. As always, it's crucial to be aware of potential side effects and to discuss them openly with your healthcare provider. They'll monitor you for any adverse reactions and adjust your treatment plan accordingly. Remember, it's not just about treating the symptoms, it's about addressing the underlying cause and finding a solution that works best for you. Chapter 5. Beyond the Big Four, other antiarrhythmic heroes. Now, we've covered the major classes of antiarrhythmic medications, but the world of medicine is vast, and there are always more options to explore. This is where we encounter medications like adenosine, digoxin, and magnesium sulfate. Each of these medications has its own unique mechanism of action and specific uses in treating arrhythmias. For instance, adenosine is often used for a condition called paroxysmal supraventricular tachycardia, which causes sudden bursts of rapid heart rate. Digoxin, on the other hand, can help control the heart rate in people with atrial fibrillation. And then we have magnesium sulfate, a powerful ally in the fight against a life-threatening arrhythmia called torsades de pointe. The key takeaway here is that your doctor will carefully consider your individual needs and the specific type of arrhythmia you have before recommending a particular medication. It's all about finding the right tool for the job and ensuring your treatment plan is tailored to you. Your heart, your health, your journey. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content. See you next time.